Then, sir, I don't know how to define this. I know that um, these days you find that most young couples, um, despite all the attempts and all that, at times they don't have more than a kid or two, and I don't know how to whether there's a medical reason for that, unlike before when I mean you people can just procreate and have as many as they desire.
Yeah. Well, I guess one of the things, I mean, is the reality check. Have you checked how much? I mean, I'm sure you know how much it costs to send children to to primary and secondary schools these days. Unlike when we were going to school, that your father could send 10 of you to school at the same time. I don't think you must be very wealthy to have 4 children in a secondary school, private secondary school now, not to talk of university. So I think that's one of the things also that is controlling the number of
Yeah,
children.
Nicole. This is Twinkle too.
Yeah, I said you asked me, I mean, why we have fewer number of children in the
Yes,
families
sir.
now.
Yes, sir.
Yes, I said it's a reality check. I mean, unlike those days where you don't need to be rich to have 5, 6 children in secondary
Okay,
school.
sir.
You dare not try it these days with the private secondary schools. And then you have 5 children in university, you are done for. So I think that's one of the things that is making people also to curtail the number of children that they are having now. And then, of course, there is family planning as well. So there's some people who are not having children, not because they don't want to have children, and not because they cannot have children, but because they don't want to have more children, because they're thinking of the quality of life. And there's some who cannot have children, and therefore they also have fewer number of children. So they're different groups, different
Okay, sir.
folks. So, yeah.
Then, sir, I was going to also ask you, how do you normally respond to um, a lot of couples or women who are supposed to fulfill the tips that you always advise that they do, like marry early, settle down, and all of that. And because of the fact that things are not as easy as they seem, many of them can't comply or fit into those set tips and all that. What advice do you always give such a couple and women?
Yes, thank you so much. That's why we also talk about other options. Like when we started from that, you can freeze your eggs, for example. If Mr. Right is not
Okay.
forthcoming, you can freeze your eggs. And so we know that that's the ideal world, but the world, of course, is far from ideal. So sometimes things happen, and you just have to be aware of the options that are open to you and to be able to take them.
And then, of course, the older women, how do they also cope? Those
Well,
who have.
yeah, the older women are interesting group, okay, because uh, some, because you pay out of pocket. Most women in Nigeria actually, who majority of the women who can afford IVF are probably past 35, 38. Okay, so there's a large group of such people in Nigeria. Okay, and all over the world. So sometimes that's where the battle actually comes from. That sometimes you have to ask some of them to use donor eggs, and that is not an easy pill for anybody to swallow initially. And that's why we have counselors who can help them go through this. And we also have a very important group of people. People, when I say this, people get the marvel that Nigerians can do that. But I say there are so many good people in Nigeria. There's some people who have gone through this experience, also who have support groups, and who try to hold these people by their hand to go navigate this very stormy pathway. So we have this support group that we sometimes, when it's difficult for a woman to take a decision, a couple to take a decision, sometimes some of them just come on the phone and talk to them. Sometimes they don't meet, and some of them become very good friends from there. Who can help them to navigate this decision-making period. Like I said, the most important thing that determines your success in IVF treatment actually is the quality of the decisions that you make.
So is it possible for you to run through those options that you mentioned just now? The issue of them, because I know a lot of people are interested in that aspect. The issue of
Donor eggs.
donor eggs, freezing the sperm, and those options and how they can go about it.
Okay. For majority of the people who are older women, they might have to use donor eggs, especially if you are above 43, because there was a study, the 2018 result of IVF in the UK was released a few weeks ago, and they showed that if you're above 43, the chance that you have a baby using your own eggs is less than 5%. And you see some people who are 45 and they say they want to use their eggs. Most of the time this will fail. Okay, and so we tell them that they probably have to use donor eggs. But we know also that it's not something that you just say and they follow most of the time. You need to talk to them, get them to understand why they need to use donor eggs. And some of them actually will only agree after they've had a series of failed cycles. Okay, so use of donor eggs, and one thing where people are afraid of, sometimes they don't tell you, is because they're afraid that what will the baby look like if I use donor eggs, And that is one interesting question that I really cannot answer. But what I can tell them from experience is that children, there is a nurturing part of bearing children. There is a nature part of children. The nature is probably what the woman might not contribute if she's using donor eggs. We are probably going to be using the sperm of the husband. So the husband is contributing to this. But we might not be using our own eggs. All right. But the good thing about this is that, what I tell them sometimes is sometimes ridiculous, that, those days when there was no IVF in the world, and women used to help their husbands by bringing children in the house when the husband's sperm is not good. You understand what I mean?
Yeah.
How do you don't recognize such children? Because children tend to look after the people who look after them. I don't know how that happens. But what I can explain it with is like, when a man marries a woman, after a while they start looking alike. They were never related, So this look thing, actually, I don't think I have all the answer to it. And that's what I tell my patients. I don't have all the answers to it. But I can tell you from experience that there's some babies, because I've done this for about over 17 years now. There's some children I have some children that are taller than I am now, And I can tell you that some of them, from donor eggs, from donor sperm, they look like their parents. So it's sometimes difficult, it's the fear of the unknown sometimes, but it's a worthy fear of the unknown. And that's why, but clinics have counselors to help them, and like I said, support groups also can help them. But sometimes it's the sperm, and that is usually even more difficult when you need to use donor sperm, And that's also, there's so many things about that. Sometimes, even when you have succeeded, you see some men reacting negatively to their wives, even when they've used donor sperm. They have a child. They are endeared to the child, but to the wife, they start behaving funny. And that's why what we try to do, for example, in my clinic, is that we try to form a large family. So we don't leave our patients alone. And that's why you see we have a lot of pictures, because it's like it's a big family. So when you have a problem, we want to come in to help you if we can. All right. And so there's some cases like that we know about, that we've tried to help them through is a phase until the husband comes around to see that, okay, this child is your child. Nobody's ever going to take the child away from you. So but it's easier when you put it into words. But some people never just say it. It's just a fear, and which is not founded in anything, but it's just something and that's why It's worse when you don't express your fears. So we have things. And we've talked about surrogacy as well, where it's possible that a woman carries a child for you. So those are some of the things that. Then we can do sex selection. We can determine the gender of the child.
Okay.
We can, for people who have AS genotype and they're married to people with AS genotype, we can help them to do the genotype selection that their babies will not be SS. So there's so many things. What was considered to be fiction many years ago is now reality with technology, and that's why because that's why I usually talk about iPhone, because anything that is technology is usually a little bit pricey, and that's until after some time when it becomes commonplace, then it probably can become cheaper. So that's those are some of the things that we can do.
How come we hear a lot more about surrogacy these days, sir?
Don't forget that Nigeria is a funny place, because there's some people who are not doing surrogacy who are calling it surrogacy. So the child trafficking industry also, they call it surrogacy. People who are buying babies also call it, they say they are doing surrogacy. So we know there are some people who say they have a cryptic pregnancy, a pregnancy that you cannot see on scan. Hey, come on. Anybody who tells you that is taking you to the cleaners. It's not true. Pregnancy should be seen on scan. So there is no pregnancy that you can't see on scan. So that's why surrogacy. Yeah.
Okay. So how is it done? The surrogacy thing. What's the proper definition of surrogacy?
Okay. Surrogacy is an arrangement whereby a woman decides to carry a pregnancy for either another woman or a couple. All right. So usually backed by legal agreement.
Okay.
So in a proper surrogacy arrangement, a lawyer is involved.
Okay.
So you have the commissioning couple or intended parents,
okay.
The people who commission this, who are the parents, who are going to be the intending parents, meeting with a surrogate or meeting through an intermediary with a surrogate. Okay. And then the surrogate decides to get pregnant. And like I said, these days, what we try to do is that we don't use the surrogate's eggs, so that there is no genetic linkage between the baby and the surrogate. So we get eggs either from the commissioning couple, but if she's too old to give the eggs or she doesn't have the eggs, we can use donor eggs, and then we use the sperm of the commissioning couple, so that there is a part of them in the baby. But sometimes also the man doesn't have any sperm, so you still have to use donor sperm. But they are the commissioning couple. They're the intending parents. And there's a state in America where that law has been made. It's not even all over America. There is the couple that intends to have a baby, that are the real parents of the baby. That's why we involved lawyers from the get-go, because it could become a banana peel if the lawyer does not come into it from the get-go. So that's the thing. That's with a surrogacy. So what we do with surrogacy is that once we form the embryo, which comes from the sperm and the egg, you now put it into the surrogate, who is prepared to receive. And then once there is a pregnancy, she carries and delivers the baby or babies. And
she carries it for 9 months.
Precisely. And then she gives the baby to the intending parents.
Somebody is asking a question. In the case of surrogacy, does it require IVF?
Sure. It's IVF. You can't have embryos outside the body without IVF. So, we need to form the embryo first before we transfer into the surrogate. So it's IVF. But there is a form of surrogacy that does not involve IVF, which we call traditional surrogacy, in which you can do insemination. That's intrauterine insemination. And like I said, even abroad now, you can order for sperm from a sperm bank. There is a kit which you can use to inject yourself at home, so you don't even need to see the doctor. But it also is possible in Nigeria that if you want to do IUI, intrauterine insemination, the problem with that is that it's traditional surrogacy. It means the surrogate is related genetically to the baby.
So which one is the preferred one, sir?
It's the gestational IVF surrogacy, where the surrogate is not linked genetically to the baby. So the surrogate cannot say, I'm attached to the baby, because you have no genetic linkage to the baby.
And I can see that a lot of our viewers are interested in what you're saying. So I don't know if you want to advice on what to do.
Well, my parting advice would be that infertility does not need to define anybody anymore. Okay? Infertility is like any other medical condition. What surprises me is that in Nigeria, when we still have infertility, we go to other places apart from the hospital. What I say is that nobody has appendicitis and goes to the church. You go to the hospital because it's a medical condition. I'm not against churches, get me right. I'm a church person myself. So I'm not against churches, but you don't have headache and take it to your blacksmith. So I think people should know that infertility is a medical condition and should be treated as such. So, but just like any other medical condition as well, it depends on where you now go to. If you have the same appendicitis that we were talking about, if you go to a quack, it will butcher you. Your intestines, you will never remain the same again, So, but the same thing, if you take your infertility to a wrong person, your life will never remain the same. So it is very important for you to go to the right place and then and see that you get yourself sorted out. And when you are in the right place also, ask questions. Be part of your treatment. You see, I keep saying that decision making is the most important part of infertility treatment. You cannot make the right decisions if you do not understand what they are doing. So unlike other parts of unlike other aspects of medicine, where you can come in and I write injection chloroquine for you, and you don't even know the name of the injection that you are taking. Infertility treatment is criminal to do that. You need to understand why I'm prescribing what I'm prescribing for you. If the doctor is too busy to explain that to you, vote with your legs. He's not the right person to talk to. So it's important that you are part of, and then, sometimes is that people, you are trying to explain to them and they're telling you, doctor, I trust you. And I say, no, you don't need to trust me. You need to understand. So it's important for us to understand, read. If you are not reading, the clinics put together all kinds of seminars for you to understand what you are going through. Please be part of it. Unless you understand, you cannot make the proper decisions. And I'll say it for the last time again, decision making is the most important aspect of fertility treatment.
Then, sir, I want to ask, is there any relationship between if a mother has has a problem, infertility problem, is there a likelihood of the daughter also suffering it by the time she gets to the point of becoming a mother?
It's possible because there's some causes of infertility that can be inherited. All right. Okay. So there's some that can be inherited, but definitely not all the causes. It does not necessarily mean that, because if, for example, the tubes are blocked and it's not endometriosis, all right, then it's an infection. If you don't get infected, your tubes are not going to be blocked. So those are not recurrent things, but things like that are genetic in nature. For example, polycystic ovaries. If you have polycystic ovaries, it's possible that your daughters will have. If you have endometriosis, it's possible that your daughters will have endometriosis. So it's possible that some things are inherited in some families, So that can be passed on. Male
How,
infertility is also
how far,
another part.
which one, sir?
Go on. Male infertility can also be passed
Can be.
on. Yeah, it can be
Okay.
passed on to the children. Yeah.
Okay. I was going to say that.
Anything that is genetic.
Okay. I
I'm
was going to say
sorry.
that. How far with the Endo initiative that you started years ago? I know it's
Yes,
another
I
thing.
think.
Yeah.
Yeah. It's something that is very interesting. That a few weeks, about a month ago or so, we formed the African chapter of it. So we're working with some other countries now to make it more popular in Africa. So because it's something that we thought was not with blacks, but of course we know that that is not true. Endometriosis is common everywhere in the world. The incidence is about the same, whether you are white or whether you are black. It does not discriminate. So but for a very long time, we were missing endometriosis in this part of the world. So it's something that I think it's worthy of talking about in the continent, all over the world. And some other parts of the world are really doing a lot in that. I mean, for example, the month of March all over the world has been regarded as Endometriosis Awareness Month. And in some countries, the parliament is involved, they're devoting money for research and so on and so forth. But, in Nigeria, where we take our time, let's say that.
Is there a way you can reduce the incidence? Can it be maybe through awareness and all that? Can it be treated or reduced?
Actually, I think you're right. It's the awareness. Because if you make early diagnosis, you see, we cannot, it's like we said, it's like some people are like that. Okay. But if you diagnose them early before some complications set in, then, for example, they might not have infertility. They can manage the spread of endometriosis before it really fills the whole abdomen up. Once you have early diagnosis, and that's why, for example, in advanced countries now, they're talking more of diagnosis in adolescents, so that the girl child we can make a diagnosis when she's in her teens, and so the decision making can be such before she becomes. Now what we're doing is that in Nigeria, we did a study, a 10-year review also, looking at the endometriosis that we see in my clinic, and we did about 200 and something people, and we saw that majority of them, we only make diagnosis because they can't get pregnant. Is when they're married and they want to start having children, is because they can't have children now that we're seeing them. So usually they are in their 30s, and so what we saw was that majority of them, about 2/3 of them, were actually already advanced endometriosis.